kanina we were talking about capillary level. So what really, we have been talking about hydrostatic pressure and oncotic pressure. These are pressures that allows flow into the intercellular space, into the cells. This time, let's look at the tissue level. Okay, we have local and humoral control, and these are the control that increases flow into the tissue or decreases the flow into the tissue. So the function of blood flow is to deliver oxygen. Clear na yun, no? Parang this is self-explanatory in delivery of glucose, amino acid, fatty acid. You want to remove carbon dioxide in the tissues. You want to remove hydrogen ions in the tissues. And then you want to maintain proper concentration of ions in the tissues and transport of various hormones and other substances to the different tissues. These are the functions of blood flow, or you want to provide that tissue needs uh, by giving enough blood flow. So nasabi ko na to before about cardiac output, but this is more in detail. Although important is the brain and the heart, but it receives 14%. The brain only receives 14% of the cardiac output, and the heart receives 4% of the cardiac output. Okay, so this is the normal. We are talking about basal condition. We are not talking about nasaksak yung pasyente, nag-bleeding. Naintindihan niyo ba ako? Kasi in that particular case, then the other flow, let's say this 15% going to the muscle will be deviated and will be added to the heart and the brain. So iba yun. We're talking about basal condition. So kung rested ka lang, the brain receives 14% and the heart receives only 4%. What is important is, eto no, yung pinakamarami, the largest percent of cardiac output is received by the liver. Okay? So another important factor is looking into the flow of blood per 100 grams of tissue weight. Kasi dito magmamatter because the kidney, despite receiving only 22%, hindi siya yung largest, no? Yung pinaka-large, yung pinakamalaking percent is in the liver. The liver, kasi maliit naman siyang organ, it receives 360 ml per minute per 100 grams. And this is because of the function of the kidney. Kailangan kasi sobrang dami ng flow into the kidney. And this is similar to the adrenal glands. So these two, the kidneys, the adrenal gland, and the thyroid gland receives parang sobrang laki ng ml per minute per 100 grams. It means to say that the flow in these organs is rapid. Okay? Oray ko na nira internet. Ano iba nga? Kaya di ako na ng internet. Sir Scott, sorry, madaling nala. Naging reklamo ka na? Okay. So acute control, long-term control. So there are mechanisms to increase the blood flow into the tissue. There is that acute control, meaning sobrang bilis lang, few seconds, few minutes, and this is by vasodilation of arterioles or meta-arterioles. Pwede din natin i-decrease yung blood flow into the tissue when these arterioles will have to vasoconstrict. Okay? Pag long-term control naman, it takes days, weeks. Ito na yung you need other hormones, let's say renin, angiotensin, aldosterone system, or you need other substances that will vasodilate the vessels, or let's say you need an increase in sympathetic activity. Ito yung long-term control. So long-term control will be discussed this coming Wednesday. So dito tayo ngayon sa acute control. So the acute control of local blood flow, if there is, ang pinaka-importante is oxygen. Take note, oxygen. When the oxygen concentration or saturation decreases, tingnan nyo, 100% is the normal oxygen saturation. If the oxygen saturation is below 90, that is something bad, okay? So, take a look. Pangit na English. Tingnan nyo na lang, Tagalog na lang nakakaloka. So, tingnan nyo. So, habang bumababa ang oxygen saturation, tumataas ang blood flow. Ganun lang siya. So, Reduced oxygen availability increases tissue blood flow. At the same time, metabolism. When the tissue is moving or it's functioning well, tataas din ang blood flow. Kunwari yung brain nyo, if you are thinking a lot, there is increased metabolism in the brain, kaya the blood flow to the brain will also increase. So, ganun lang siya. So, the tissue metabolism is increased, the blood flow is also increased. If the oxygen is reduced, the blood flow is also increased. Which of the two is stronger, is more powerful? It is oxygen. Reduced oxygen will increase blood flow. Okay. So, there are vasodilator substances that are released. And pinaka important dito is the adenosine because nandito tayo sa heart. Adenosine is if there is myocardial ischemia. When we say myocardial ischemia, decreased blood supply to the myocardium. And when this happens, there will be release of adenosine. And this adenosine will cause vasodilation of arterial, coronary arterial. So these are the substances that will vasodilate. This time, you have to memorize these. Kasi may merong question na lalabas na this is vasodilatory or vasoconstrictor. So you have to memorize. So despite the role of adenosine to cause vasodilation, hindi lang siya ang nagkakos ng vasodilation. There are other substances that causes vasodilation. Kasi this has been noted by giving adenosine medication, the vasodilation of coronary arteries is not prolonged. Hindi siya parang after a while, nagba-vasoconstrict din or hindi nami-maintain yung vasodilation ng coronary arteries. And so there are other vasodilatory substances like carbon dioxide, adenosine phosphate compounds, histamine, potassium ion, and hydrogen ion. Okay, so we have talked about vasomotion. This is the cyclical opening and closing of precapillary sphincter. By opening and closing, you allow intermittent flow of blood in the capillary. So this is what we call as vasomotion. All right. So the vasomotion is improved with this metabolic control of local blood flow. Ito yung either reactive hyperemia or active hyperemia. Ano to? So if you close the artery for 1 to 2 seconds, after you release that, there will be an increase in blood flow. Kasi kanina 1 lang, it will be increased by as much as 4 to 5 times after releasing the occlusion. So if you occlude the vessel for 2 seconds only, once you release that tremendously, the blood flow will be increased 4 to 5 times the previous flow. And this is what we call as reactive hyperemia. Ano naman ang sinasabing na active hyperemia? If you keep on stimulating the tissue, it will cause an increased flow into the tissue. So this is what we call as active hyperemia. Either of the two causes an increased local blood flow. Okay? So iba ang autoregulation. So for example, you have increased the blood flow. There is also what we call as autoregulation. Ibig sabihin, i-decrease naman yung flow kasi too much na. So sa capillaries kasi, dapat not too much, not too low. So dapat maintain lang. So if there is a sudden increase of flow, like in active hyperemia or in hyperemia, for example, there will be autoregulation will fit in after that. So the autoregulation can either be from metabolic theory or myogenic theory. So yung metabolic theory states that if there is an increased nutrient, let's say oxygen, kasi diba, you have increased the flow, so there will be a lot of oxygen there. So you have also increased the flow, meaning to say yung mga vasodilator substances natanggal kasi increased yung flow. So because of that, a decrease in vasodilator substances and an increase in oxygen, there will be vasoconstriction of the arterioles and the sphincter, causing a decrease in flow. So kaya naibabalik to previous pressure, yung previous pressure and previous flow in the capillary. Yung sinasabi namang myogenic theory, this is high arterial pressure stretches the vessel, and because of this stretch, in the vessel, it will cause parang siya or vascular constriction, which will again reduce the blood flow into back to normal level. So kanina, yung increased blood flow is by hyperemia. Yung pagbalik naman ng pressure back to normal is by autoregulation, and this is by metabolic theory or myogenic theory. Theory lang sila, no? Kasi hindi ko masyadong sure daw, kaya theory lang. Okay. So, nitric oxide is a vasodilator released in endothelial cells. So, in the endothelial cells in the coronary arteries, there are nitric oxide. So, pag yung pasyente mag-heart attack, this nitric oxide are released and it can cause vasodilation. So, we have nitric oxide na medications, yung isoflurane mononitrates, these are nitrates. These are given to patients na nag-angina or nag-heart attack. So, it will cause vasodilation of vessels and will improve flow into the myocardium. Endothelin is opposite. It's a powerful vasoconstrictor in the endothelium. So we are talking about inside the vessel. So nitric oxide will vasodilate, endothelin will vasoconstrict. So the blood flow regulation changes by tissue vascularity because if the metabolism in the tissues increase, there will be formation of new vessels and we call it angiogenesis. So yun yung the process of increasing the vascularity, angiogenesis. So for a longer period of time, if your body is exposed to high altitude, kasi pag nasa high altitude, yung oxygen concentration sobrang hindi sobrang hindi maganda yung oxygen, no? Kaya you are exposed to hypoxemia. And because of this, there will be changes in your body to increase flow. Ang nangyayari yan, yung mga pasyente, no, dumadami yung red cells nila. So that kahit konti lang yung oxygen na nakukuha mo from the environment, at least marami naman yung red cells na magde-deliver. Kaya yun yung mechanism to improve flow. Okay? And there are also vascular growth factors that are produced, which improve the angiogenesis, or let's say can either there are changes in the vessel that can improve flow. So ito yung mga vascular growth factors. So vascularity is determined by maximum blood flow need, not by average need. Kasi for example, yung muscle, kung ang average flow lang ng muscle is let's say 2 liters lang, mahihirapan tayo kasi for example, tumakbo ka, you need let's say 6 liters of blood. Paano yan kung ang vascularity is determined by average need lang? Hindi ka masusuplayan ng 2 liters, ng more than 2 liters, then there will be ischemia to the muscle. So because of this process in blood flow, that vascularity is determined by maximum blood flow, not by the average need, you are able to function in terms of emergency. So blood flow regulation by development of collateral circulation. So aside from angiogenesis, meaning increased microvessels, there are also times wherein you create new vessels, parang malalaki na vessels, not microvessels, but let's say arterials na para siyang roots na nagpo-form to supply the myocardium kung nag-heart attack ka. So if a patient have a lot of collateral vessels, it decreases the size of the infarct. Or the mortality of the patient is also decreased. So in patients with diabetes mellitus, the collateral vessels are decreased. And that's why pag nag-heart attack ang may mga diabetic patients, malaki yung myocardial infarction. Alright? Yes. So these are the vascular remodeling. Pag sinabi nating inward eutrophic remodeling, kumakal lang yung thickness niya. But the size is still the same. Kumakal yung thickness, therefore, the lumen has decreased. So, ito yung lumen niya malaki, ito lumiit. So, ang prototype example nito is yung pulmonary arteries natin. So, if there is too much pressure in the alveolar, in the lungs, pag sobrang taas ng pressure for a longer period of time, the arteries, the pulmonary arteries, there will be thickening of the wall of the pulmonary arteries, okay? And this will increase the pressure in the pulmonary arteries. So yun yung mechanism niya to increase the pressure in the pulmonary arteries para mas mataas ang pulmonary artery pressure than the alveolar pressure so that there will be flow. Kasi kung palagi lang mas mataas si alveolar pressure, then walang flow from pulmonary artery to the lung. So the mechanism to do this is to increase the vessel wall of the capillary. Hello? Andyan pa ba kayo?
Yes, Doc. Yes, Doc.
Sorry, tinawagan
Yes,
tatay. Ano bang name mo?
Yes po, Doc.
Anong name mo ulit? Forgot the name. Anyway. So, yan yung example ko, yung naririnig nyo to? Naririnig nyo pa ba ako?
Yes, Doc.
Eutrophic remodeling.
Yes po, Doc.
The best example here is increase in the thickness of the wall of the pulmonary artery if there is too much pressure in the lung. So by increasing the wall thickness, the lumen will decrease here, and so it will increase pressure because the resistance will increase, so the pressure will increase. And so, I mean, not the, yes, the diameter or the cross-sectional area will decrease, or the area will decrease, and so it will increase the pressure. And that's why tataas ang pulmonary artery pressure, somehow it will aid flow into the lung. So this is hypertrophic remodeling. Ibig sabihin, kumapal, so it increases the thickness and the cross-sectional area. So both, ito, lalaki siya, tingnan nyo yung size niya, mas malaki, plus the thickness of the wall also has increased. So the best example here is yung sa venous vein. Pag nagko-coronary bypass graft, I don't know if you've heard about this, but this is in patients na nag-heart attack, so yung coronary artery nila may obstruction. So ang ginagawa, kumukuha ng sa venous vein sa legs, and then yung vein na yan will be reconstructed from the artery to the myocardium para yung flow will be bypassed, not through the obstructed vessel na meron ka ng bagong vessel that will flow and deliver blood into the infarcted muscle. So, I mean, not to the ischemic muscle. So, yan yung bypass graft. So, ang ginagamit most of the time is a, wait lang, may tumatawag ulit. Diyos ko, Lord, yung na-admit na pasyente. Bleed. Basal ganglia bleed. Kawawa naman. Okay. So, hypertrophic remodeling, lumalaki yung size ng vessel. The lumen will also increase in size. And at the same time, the vessel wall will also increase in thickness. So, kung ang best example nito is yung sa venous vein na i-graft mo doon sa artery. So, yung artery kasi pressure mataas yun di ba? Arterial pressure, arterial flow is higher pressure. Vein siya. Sanay siya sa low pressure. So, ang mangyayari yan, ganyan yung mangyayari sa kanya. It will be dilated because of an increased flow, and because of an increased pressure, it will have an increase in thickness. Naintindihan niyo ba yon?
Yes, Doc.
Yes, Doc.
All right. Okay. So, meron tayong tinatawag na outward remodeling and outward hypertrophic remodeling. So, ang best example nito is in AV fistula creation. I hope yung mga nurses siguro maintindihan nila ito, pero just in case hindi ka medically related, yung mga dialysis patients, inooperahan sila kung saan yung big artery i-attach directly sa vein. So wala nang artery, arterioles, capillaries, venules, veins. Hindi na. This is artery, veins. I-unite sila. Kasi para mayroon kang venous access for hemodialysis. So yung arterial end will have these changes, okay? Yung outward remodeling. Meaning to say, there is an increase in lumen, there is a little change lang in wall thickness kasi artery naman siya, and there will be also an increase in total cross-sectional area vascular wall kasi medyo sobrang lakas ng flow na eh. Whereas on the venous side, it will have lahat, sobrang change na lahat. Lumaki yung lumen, lumaki yung wall thickness, lumaki yung total cross-sectional area, the biggest ever, kasi vein siya. So, yan yung mga best examples dyan. So, ito, outward eutrophic remodeling, pulmonary arterial pressure increases because of thickening of the wall of the vessel. Hypertrophic remodeling, this is seen in saphenous vein during a bypass graft in a coronary artery bypass graft surgery. And then outward remodeling on the arterial end of the AV fistula, and outward hypertrophic remodeling on the venous end of the AV fistula. All right. So wala tayong choice. You just have to memorize these. These are powerful vasoconstrictor, norepinephrine, epinephrine, angiotensin 2, vasopressin. And I forgot. Actually, meron pang very, very most powerful of them all. I forgot the term. I think it starts with letter U. I-search nyo na lang. Meron pang mas powerful, but hindi siya ginagamit kasi sobrang powerful. Hindi siya makontrol. A small amount of this hormone, it will cause death kasi sobrang vasoconstricted lahat ng vessel. So, kung susumahin natin lahat, vasopressin is even more powerful than angiotensin 2. So, I think among all these four, I would answer vasopressin as the most, this is the strongest vasoconstrictor agent. Okay? Yeah. So, vasodilator substances naman are adenosine, bradykinin, histamine. Yung pinaka-importante sa myocardium is adenosine. Ito kasi yung mas marami. Ito yung most common na re-release to increase or to vasodilate the vessel. Okay, so hiniwalay ko na, there are chemicals that also vasodilate or vasoconstrict. So lahat ng naka-blue is vasodilator, lahat ng naka-red, isa lang naman siya, calcium ion vasoconstrictor. So kung kayo yung gagawa ng exam, all of the following are vasodilators except. Kasi isa lang naman siya, no? Or which of the following is a vasoconstrictor? Tapos, ang sagot, calcium ion. Ganun lang. Hindi ka na magme-memorize ng ibang substances. Bahala na sila sa buhay nila. Ang i-memorize ko lang, calcium ion para tipid sa neurons. Yay!